Well, actually, Palm Drive handles almost every insurance program. So whether you were Blue Shield, Blue Cross, had SCAN, or other HealthNet or other programs, the only programs that Palm Drive and now Sonoma West Medical Center wouldn't handle on a inpatient basis, or an elective basis, I should say, would be Kaiser. Kaiser's got their own hospital and their own plans. But one thing that people don't always realize is that with a Kaiser patient can go to any hospital for emergency care. And they certainly should go to the nearest one for serious matters. And many Kaiser patients can be treated here, have been treated here in the past as emergency patients. It's very, very important that if you have a serious emergency, a stroke, or other kind of condition, you should go to the nearest stroke center, for example, with a stroke. Both Kaiser, by the way, and Sonoma West Medical Center have very high quality stroke programs. That's not true of all the other hospitals in the area, by the way. These are really the best stroke programs around. Healdsburg also has a stroke program. Sutter Hospital does not have a stroke program at this point in time. Okay. I recommend that if you're a senior, 65 or older, and therefore Medicare eligible, that you would get SCAN. SCAN is a program that started in Southern California many years ago and came into this area just last year. It's a zero premium senior plan. What that means is you don't pay a monthly fee for it. They get all of their money from Medicare to provide your services. And so that's actually very, very competitive with any of the other Medicare Advantage plans. I believe that Kaiser's Medicare Advantage plan right now is about $79 a month. So you're saving $79 a month right off the top. I chose SCAN because SCAN also gives you coverage in any place in the world for emergency care. So if I'm in the Philippines, I travel quite a bit, I can go to an emergency room there, and actually all the costs of that would be covered by my SCAN plan. So both Joan, my wife, and I are covered with SCAN. The other, you mentioned Western Health Advantage. Western Health Advantage is also new to the area. It's very competitive with Kaiser. It's part of the Covered California program, and also employers can sign up for Western Health Advantage. I believe that Western Health Advantage doesn't have individual plans outside of the Covered California program, but employers can sign up for that as well. Larger institutions can do things that smaller institutions can't. For example, we won't have a cath lab here. We won't be doing open heart surgery here. We're not a trauma center here. That doesn't mean if you have a broken leg you shouldn't come here, but if you're in a major auto accident, you will be taken to the trauma center in the area. So larger institutions do certain things much better, and they're more capable than a small hospital like this. On the other hand, small hospitals can be much better at personalized, high-quality care close to home. And a lot of physicians, you did an interview earlier with Dr. Graton, you met him. He's an amazing urologist. He likes working in a smaller environment because he can take better care and more personalized care of patients. Patients tend to get lost in big institutions, and they tend to be forgotten about sometimes in the middle of the night. A patient who comes into this emergency room, if they're a Kaiser patient, Kaiser will pay us for their care. They're always very good about that. Kaiser's very good about managing emergency services outside of their network when somebody has an emergency. I'd actually like to say something about ambulance deliveries. Only 15% of the people who show up in emergency rooms come by ambulance. Almost all of them, the other 85%, they show up in a car or walking sometimes even. And because when you have an emergency, a life-threatening emergency, you don't at first know what's wrong with you. You might think, oh, I've got a terrible stomachache. Oh, I must have eaten something really bad. You might be having a heart attack. Or you might, we know of a young woman whose life was saved here who had a ruptured tubal pregnancy. She didn't know she was having a ruptured tubal pregnancy. She thought she was having terrible gastric pain. But she luckily showed up here. She would not have made it to Santa Rosa, by the way, because by the time she got here, her blood pressure was about 0 and she was passing out. But her life got saved because she came to the nearest emergency room. Having close by emergency care makes all the difference in the world when you have a life-threatening illness. It's not just, however, how close the hospital is, it's how close the doctor is. So if you go to a hospital and wait 4 hours and you have a heart condition, that's not a good situation either. You really need to be able to get and see a specialist immediately.